Hello and welcome to the Good Health Show with me, Jess King. As you can see, this is being brought to you from my house, not the Mail Plus studios, as we, like many of you, are working from home. Let's start off this week talking about testing for coronavirus, a subject that has been very much in the news and something that the government has come under criticism for not rolling out fast enough, particularly to health workers on the front line. Well, Dr. Bharat Pankhania is a senior consultant in communicable disease control. He's worked on other outbreaks such as Ebola, SARS and influenza. And we started off by talking about the types of tests available for COVID-19 and also the UK's response in comparison to other countries.
We have the one test, which is called the reverse transcriptase PCR. What we do with that test is we identify the presence of the virus. So we take a throat swab, nose, throat, and we put it into reagents, and these reagents will identify for us if the virus is present there. So that's the critical thing. It's looking for presence of the virus. That's the reverse transcriptase PCR test. Okay. The other test is an antibody test. So after you have been infected and survived the infection, you are likely to make antibodies against this type of virus. And there are two types of antibodies that you usually make for such infections. We call them IgG and IgM. And what this test does, it looks for the presence of these antibodies to indicate that you have been infected by the coronavirus COVID-19 and made the correct antibodies against it. So those are the two tests that we have.
And out of those two tests, is it more important, in your opinion, to have the test that shows whether someone currently has the virus?
What we want to do is immediately identify who may be a case and then remove that case from circulation and also remove the contacts of that case from circulation. So that's the reverse transcriptase PCR test. The other one, the antibody test, is basically to tell me, yes, you've survived an infection. It doesn't tell me any more at the moment. The assumption is that because you got presence of antibodies, that you're going to be immune. But it is an assumption. We don't know for sure. Just because you've got antibodies doesn't mean you drop your guard on getting infected again. You need to continue with your infection control measures that you've already been taking.
There's a lot of talk about how many tests the UK is doing, and we seem to be perhaps not doing as many as people would like and behind the level of tests per head compared to countries like Germany, like the USA. Why do you think we are not doing as many as we possibly could be doing, and how critical is that?
The German government is doing phenomenally well. I mean, phenomenally well. They are testing as per WHO guidelines. And as a result of testing, plus they seem to have better resilience in their healthcare systems. America, on the other hand, has also not been doing enough tests. And as a result of America not doing sufficient tests, we will also see in America an escalation of a number of cases and unfortunately deaths as well.
The testing and the figures that we're seeing every day, you know, there are lots of different news outlets, there are lots of different scientists and experts giving their predictions on trends and curves. Any advice for people who are trying to sort of interpret this data that we're seeing from so many different sources?
So we've had for example, the people from Imperial who produced their mathematical modeling paper, and that mathematical modeling paper has obviously given the great big wake-up call to the government, which is worst case scenario, you could get 250,000 to 500,000 people dead. That is huge. That is a huge, huge, huge number. And that paper also then sheds light on China, South Korea managed to do extensive contact tracing, extensive removal of people from circulation who were cases, and they managed to bring it down. Of course, they also brought in very, very early control measures like restrictions of movements, gatherings, crowds, that sort of thing. And as a result, they were able to flatten it and lower their rise in the number of cases, which is what we want to try and also do. We are unfortunately now playing catch up. I appreciate we are in what we would call shutdown mode, but the virus is already in circulation, and we now have to hope for the best.
Did you ever imagine that you would see something like this?
In 20 years as a consultant and say 10 years leading up to it, I never ever came across a situation where we discussed people will be left to die on their own. This is unbearably painful for me to realize that your loved ones may die alone. You can't hold their hand. This is unbearable. And the reason is we haven't got enough PPE for our loved ones to don, to sit by the person who is dying and hold their hand. I find it unbelievable and unbelievable pain that we've come to this stage. How did we get here? It's just, I can't come to terms with it.
So in terms of the PPE equipment, the personal protection equipment, you know, a lot of NHS workers have been saying they don't even have enough on the front line. You know, that seems to be improving, but, you know, for many people and for many who are returning to work after retiring, you know, doctors, healthcare workers, many are returning to work. I mean, there must be a lot of fear and a lot of challenges out there.
A lot of fear, a lot of challenges, and I'm finding stray doctors and healthcare workers just finding me on social media and saying, look, we are scared, we can't talk, but can you talk on our behalf? And I'm not the only one. The BMA and other places are inundated with worries, concerns. We are in the front line and we haven't got adequate PPE.
Well, the coronavirus pandemic has put a huge amount of pressure on ambulance services, particularly here in London. Will Broughton is the Director of Professional Standards at the College of Paramedics. I spoke to him earlier this week and he said they're busier than ever, and there's still quite a lot of worry and concern among staff that they don't have the right or enough protective kit.
So paramedics are seeing, you know, unprecedented demand on the front line, and it really is exceptionally busy, and the ambulance services are dealing with demand that they've never seen before. There is a worry that we're attending these patients who may or may not have symptoms or may not have this coronavirus, and that alongside some of the concerns that continue to be raised about the personal protective equipment, because as a frontline paramedic you might see 8, 10, 12 patients in a day, and we don't want to be transporting anything between those patients.
And do you feel that you've heard the government's reassurances that they are getting more kits, more masks, more protective gear? Do you feel encouraged and supported enough by that?
There is obviously a lot of messaging coming out from the government to say that there is no problem with supply, but unfortunately members, paramedics, frontline staff in all settings continue to say that the equipment just isn't there. And whilst some areas are seeing deliveries of this equipment, and for the most part I think it is being provided, there are still pockets of the NHS and the frontline services where they don't have what they think they should need.
Are there any concerns that we're being told a lot, you know, don't call 999 unless, you know, you do think you are really serious? Are there any concerns that people might be in a quite serious condition but think, well, am I not? And I've heard that, you know, it can develop quite quickly into quite a serious situation. So is there a concern that perhaps too many people being told don't call 999 who actually maybe should be?
I think we would always say that if you genuinely feel that your symptoms are life-threatening, you know, and that includes things like being unconscious, being unable to breathe, being unable to catch your breath at all, then absolutely call 999, and the ambulance service will work as hard as it possibly can to make sure that you get the right response. I think what we would say to people is that the response that you might have received before this pandemic will change now, and actually you might receive an assessment over the phone by a paramedic in the ambulance control room. And that is both to reassure you and to make sure that you, if you do need an ambulance, that it is sent to you as quickly as possible.
And how are waiting times at the moment?
So people are going to wait longer for their ambulances. That's an unfortunate circumstance of where we are right now. That is to make sure that we can send as many emergency ambulances to the people who absolutely need them. And where you are waiting longer, that means that you've been through a process, you've been triaged by the ambulance service or by 111, and at the moment your symptoms aren't severe enough to send you an ambulance immediately. But it's important to understand that there are only a certain number of ambulances, and at times there might not be any left, and so waiting times will be longer. And that's why we need to really make sure that people use the other services that are available, including their own GP when it's in hours, as well as the 111 service and online services, to make sure that we're not just pushing demand into the ambulance service.
And you've talked about, the demand at the moment. From everything we're hearing, it's likely to get worse in the next couple of weeks. How do you feel, and how's the morale among you and your colleagues about sort of the forecast and the outlook for the next couple of weeks and perhaps months?
I think the pressure that we're seeing at the moment is putting morale quite low, and staff are worried about the risks to them and the risks to their families, which isn't helping to keep morale high. The demand that we're seeing is something that we've never really dealt with before, and so as we are being told that the number of patients and the number of cases will continue to increase, I think there's a real important message that needs to go to staff, to make sure that they really do feel supported, to make sure that the volunteers that are being recruited are deployed in a way that helps to improve morale, and to make sure that those who are professionally qualified and providing frontline services are able to do that in as favourable circumstances as they possibly can.
You're doing a fantastic job. Thank you very, very much for talking to us. Well, many people who'd retired or left the health service have answered the government's call to return to work. After 15 years with the NHS, James Birdseye left his job as a paramedic 6 months ago, but after seeing the corona crisis develop and unfold, he felt compelled to go back.
So I've been working in the ambulance service for 15 years, 10 of which as a paramedic. And I just found that every day the pressure was getting greater and greater on sort of myself and colleagues. And I, over the last couple of years, I sort of wound down a little bit. I moved to part-time to look after my 2 children. And I just suddenly found that I was starting to get stressed about work when I was when I'd almost finished work and I had quite a significant time off. So very much was in that situation where it was like, enough's enough really. And I enjoyed it. I miss the people. I miss the camaraderie. I miss the friendships. I miss that side massively, but I don't miss the the very, very intense part of it, but also there's this sort of yin and yang approach, because what happens is that you'll go to someone who's very, very sick and poorly, and then straight away afterwards, you'll then go to say someone, and I don't mean this facetiously, this is absolutely true, with some like a stubbed toe, that phone 999, and and you start getting cross, and that's not good. So So given you've described what is an incredibly stressful job, situations that you found yourself in, a lot of paramedics suffering from anxiety and stress, post-traumatic stress disorders after being in those very pressurized situations. But we've had this call, the government have asked for people to go back, and you've answered that call, and you've said that you would be prepared to go back to frontline paramedic services. This is our war, really. This is war. And if I didn't, that kind of guilt would start eating me up a little bit. If you go into healthcare, you tend to go into healthcare for a reason, really. And it's that feeling of, and actually, dare I say, it's not necessarily the patients that is my main driver. And I know that sounds a bit strange, but the main driver is actually my colleagues, because I know that they're out there now, and my friends are out there, and they're working really, really hard. Like, it's insane. And I'm kind of like, I can't just be sitting on my bum doing nothing. So there's obviously wanting to make a difference, but there's also that feeling that actually, it literally is completely all hands to deck.
Well, thank you very much for talking to us, James, and best of luck with the incredible thing that you're doing, going back to being a paramedic. It's really amazing. As well as James, who's returning to the ambulance service, we've also spoken to June. She's a nurse in neuro rehab, and she's now taking on a lot more shifts at her local hospital in Newcastle.
Initially, it was doing the odd shift now and then, was sort of like keeping my hand in with the nursing. But at the moment, obviously, NHS staff who are high risk aren't allowed to go into work, which in result has caused a shortage on the wards. So because of the experience I've got and the need, I've sort of gone back in. I've picked up more shifts to help cover where they're short.
And how do you feel about the sort of being in the hospital environment? Are you worried about having enough protective kit? Are you worried about potentially contracting the virus?
I am, but there is precautions in place. We do have like the aprons, the gloves, the masks and all that. And we just do the best with what we've got. The hospital's really good when there has been a case of corona, that they go all out, and there is a lot of support there. The managers come down to the ward and everything, and outside services stay away from us, so there's no chance of spreading it to other departments and stuff. The ward basically goes on lockdown. It is scary, and it's frightening coming home knowing that you've been in touch with somebody with the virus. But no, my kids are quite good. They're growing up, fortunately, and I'll just phone ahead and say, just make sure nobody's downstairs, keep the dogs out the way, make sure the washer door's open so that my uniform in its bag and everything can go straight in the washer, and then I shower and everything before even speaking to the kids, really. I have been exposed to the coronavirus at work, but I haven't hugged the kids since. We sort of, even though we're all in the house, we are like keeping that distance. Still, it is scary. The kids maybe will get it, but they stand a better chance of recovering from it because they're younger than if it was somebody older who I was exposing it to if I'd carried it home. It is scary. I'll admit I have been scared at work, knowing that I'm looking after somebody with the virus.
And how encouraged are you and your colleagues that a lot of people have answered the government's call and said they would be prepared to come back to work at sort of all levels in the health service?
It's fabulous, but that's nurses for you. You are like a big family, We've all got like a strange sense of humour, but we all understand it. And I'm not surprised so many people have returned.
And
you're supporting the colleagues that are there on the ward, because we know we've sort of lost some who can't come to work for underlying health issues. So we step in and bridge the gap.
Jude, thank you very much for joining us on Plus.
Well, thank you to all of my guests today for sharing their expertise and their stories. If you'd like to keep in touch with us, or if you have any questions or concerns, please do email us on coronaquestions@dailymail.co.uk. I'll leave you now with fitness expert Marvin Ambrosius, who has done an exclusive quick 5-minute workout for our Mail Plus viewers. You can do this anywhere in your house, in your garden,
or anywhere you have a little bit of floor space. I'm Jess King, and I'll see you next time on The Good Health Show.
Hi, my name's Marvin Ambrosius, and we're going to be doing a workout today, and this is exclusively for my Male Plus viewers. We're going to be doing a Fit in 5 workout. Now, no equipment necessary, just your body weight, and this is just to get that blood pumping, get that energy going, and remember, this is for all levels, so do it at your own pace. You ready? Let's get Fit in 5. Start with that jog on the spot. Try and pick those legs up, really getting them up nice and high. That's it, just get that jog, we're just getting the blood pumping through our body, get everything moving at the same time. That's it, kick the legs back. If you want to, you can bring the feet even further back, getting the hamstrings nice and warmed up. That's it, take advantage of the sun as well if you can get outside, guys, get that vitamin D. Again, jogging on the spot, guys, just giving blood flow, getting everything working all at the same time. Now, first move we're going to be pushing into is our step forward lunges. So we're going to step forward, change legs, step forward. Now, if you can't get as much range of motion, just do a half step, change. But if you can, where I want you to be is all the way down. Go down in position, down in position. There we go, working our quads, getting those all working nicely together, getting those glutes working as well. And again, already, your heart rate should have gone up now. Should be feeling quite good. So you're gonna get some plyo in it now, so feet together, touching the ground, coming back up. If you want to, you can walk this. You can simply walk it out. But this is where I want you. Straight down, straight up, straight down, and back up. That's nice. Now we're ready to work. Body knows it's time to get that workout in. Let's get ready for that next set. Going into those jumping jacks, so feet together, so you can be from there, that's your modifier, going into it, getting a little bit harder now. Make sure the arms come to the top, stay on your toes as well, really important, stay on those toes. That's it, focus on your breathing. Remember, it's just 5 minutes, but you're thinking, you can really feel yourself working now. Full body movements, getting right through. All right, now we're gonna slow it down into the squat. Coming down, up, straight down, up, squat, up. Try and create some depth. All the way down, keep that back nice and straight. If you can't get all the way down, don't worry. So if you're feeling it in the quads, really in there, squeeze those glutes at the top. Squeeze them. That's it. And then we're gonna get into our step backs now. So, step backs is when you just step. So it's not a lunge, you got a half squat, and you're stepping back. That's it. Stay on the toes at the back. Push from the toes, getting the calves working. Excellent, team. Let's go, Male Plus, guys. We're getting it in now, let's do it. Stepping back. Focus on your breathing now. Deep inhale through the nose. Exhale out the mouth. Now small squat jumps. From there, let those feet leave the ground. Now to make that modified, just go down onto the toes. Squat onto your toes. But this is where I want you. I want to see some air between the ground and you. Make sure there's some air between you. That's it. Keep it moving. See, all the way up now, I've got that deep burn in my legs. Oh, there we go. Now we're gonna go to step back lunges. Pulse, pulse. Change legs. For the step back lunge, pulse, pulse. Again, you don't have to go all the way down. We just wanna get it there. Really working. Knee stays behind the toe. So at this position, coming down, that's it. Stepping back. We're looking good, guys. We're in that workout now. We're hardcore in it. And then, guys, feet together. We're gonna go step back, step in. When you come to the middle, small squat, squat down. Half squat, squat down. That's it. Looking good, team. Keep it working. Come into the middle, stepping out to the side. Last 30 seconds coming. And mountain climbers to the top. Knees up, arms up. That's it, guys. Keep the arms going. Knees staying high. If you can't, walk it out. It's fine. Nearly there. 10 seconds left. Pushing it through. 3, 2, 1. That is it. That is your Fit in 5 workout complete for our Male Plus viewers. And remember, guys, sharing is caring. Get everybody you know to get these small HIIT workouts in to help you become the best version of yourself.